Hi there, YouTubers. This is Tay, Georgia. And tonight I'm coming to you for the first time post-op VSG. Today is Sunday, November the 4th. Just make sure there. Sunday, November the 4th. And it's about 10 o'clock at night now here in Georgia. I had my surgery this past Friday. And so what I want to do is just talk a little bit about my prep for the surgery and then tell you about my experience there. My prep for the surgery just included my doctor telling me to do about 2 weeks of a low carb diet. She said to cut out white rice, bread, sweets, pasta, things like that, and to just double up on protein shakes and eat high protein. So, meat, beans, other things with lots of protein. So that's what she wanted me to do. And then 2 days before the surgery, I was to do clear liquids. And also the day before surgery, I did milk of magnesia, 3 tablespoons that morning, as well as I took 12 500 milligram neomycin antibiotic tablets. I took 2 an hour for 4 hours, and then 1 an hour every 4 hours after that. So I started at about 8 o'clock in the morning, Thursday morning, and I was finished by middle of the night Friday around 2 or 3 in the morning. And then that morning before surgery, they only wanted me to take my Prilosec, which is something that I took for reflux. So my surgery was set for Friday at 1:30 at DeKalb Medical Center with Dr. Rashid, and I got there at 11:30. They took me back almost immediately, got me ready for the surgery, and they took me back, actually to the surgery area right at 1:30. They allowed my husband and my mom, who were with me, to come back to the waiting area after I had, where we just waited. After they had gotten my IV in and got me a gown on and TED hose on my legs and some socks and something for my hair. So they took me back. It was kind of nice because I used to actually work in this very OR, and I knew my circulator. I knew the nurse that was taking care of me. She had actually trained me, so I was really comfortable. I knew that the anesthetist as well as the anesthesiologist. I didn't know them well, but I knew them enough that, I had seen them work, and I knew of their professionalism and whatnot. So they had me put the mask over my face. They told me that the best thing that I could do to help them, with what they needed to do for me safely, was to take some very deep breaths. So I took very, very deep breaths as hard as I could, and then they told me I would feel something sting in my IV, and then I fell asleep. The next thing I know, I woke up in recovery with lots of people around me, and that's where things got interesting. I heard people saying things like, oh, her heart rate is so high, she's tachycardic. Oh boy, we've already given her this, we've already given her that. Breathe deep, honey, breathe deep. And so as it turned out, I had gone into atrial fibrillation right there in recovery. Well, I'm assuming that I went into it in recovery. And so with that, as the doctor said, I bought myself a night in the ICU. So the doctor was right there. She did tell me that my surgery had gone perfect. I only lost like a teaspoon of blood during the surgery. Everything was great with the surgery, but I guess my heart just didn't like the anesthesia or didn't like the surgery. And so I went to the ICU. And the reason why I had to go to the ICU is because they needed to start um, medicine in my IV, a drip, if you will, so continuous medicine in my IV to try and get my heart rate and heartbeat under control. Try to get it to a normal rate, which is 60 to 100, and mine was like 180 to 225 at times, sometimes higher than that, and to get it a normal rhythm, as opposed to being in atrial fibrillation. The big danger of being in atrial fibrillation is blood clots. So I had to go to ICU because the ICU nurses are the nurses who would need to be monitoring me and controlling this continuous IV medicine. Luckily, about 2 o'clock in the morning, my heartbeat went normal. Totally, it was a normal rate as well as a normal rhythm. So they started to wean me off of that medicine. They got me off of it totally when the cardiologist came around the next day. By then I was on a very low dose. And so they ended up taking me to my room, to the bariatric floor at DeKalb, about 8 o'clock in the evening yesterday, which was Saturday. So I started drinking. I started walking. And things went really well. I didn't have a lot of the gas pain that people talk about. One tip that I can give you, that the nurse gave me, is that when you're in the hospital, at least I'm not sure whether it's just when you're in the hospital or just 1 or 2 days post-op or in general, but she said that she really encourages her patients to drink Crystal Light as opposed to the juice. The nurses in the ICU had given me apple juice because they first they had given me orange juice, and I told them I couldn't do the orange juice because it wasn't a clear liquid, but they had given me apple juice, and the bariatric nurse told me to stick with Crystal Light as opposed to the juices because the juices cause a lot more gas. So yeah, I didn't have the gas. I really haven't had it much at all so far. I've burped a little bit. I've passed a tiny bit. But as far as causing me pain, no. My pain is from the incisions. I have 5 incisions. The one in the belly button and then the one a little further up are causing me the most pain. And it is enough pain that I want to go ahead and take the Lortab. I don't know. I know some of you have reported that you don't really take the pain medicine, but I feel like I need it. My doctor wants me to walk. Even though I don't have the gas, she's saying just walk. She wants me to walk a lot, and I'm trying to do that. Trying to get in fluids. I haven't gotten in a lot of fluids. I've probably, I can't even tell you because I haven't written it down. I've just tried to continuously drink all day. I felt really, really good. I've actually had a decent amount of energy. So I'm not sure, why, but I'm actually feeling pretty good after this surgery, even though I did that detour through ICU. So that's really what I wanted to tell you all about. One other little side note that I can tell you is that since I came on here the first time, I found out that what I thought was just some arthritis in my left knee, I found out that it's actually a meniscal tear. So I'll need to be having surgery on that here soon. My doctor says she wants me to wait about 4 to 6 weeks. So hopefully by the end of the year, I'll be getting that fixed because I'm limping pretty bad with that right now, and it's definitely gonna stop me from exercising the way that I want to be exercising. So that's really all that I have for you tonight. I'll just let you know that my doctor told me to go ahead and do clear liquids the rest of the day. So I'm actually on post-op day 3. Friday I had surgery, and today is Sunday. She wants me to, so actually this is post-op day 2. Friday was the day of surgery. Saturday was post-op day 1. Sunday is post-op day 2. And she wants me to start full liquids tomorrow. And so I'll go ahead and do that. Some sugar-free pudding, protein drinks that I like to make out of fat-free milk. I bought Undree's vanilla, Undree's chocolate, and they're unflavored. I'm not really sure what I'm going to do with the unflavored. I thought I would make things like Jello, but right now I don't want any Jello. I did drink some, and I did eat some in the hospital a little bit, but I don't really want any now. And I bought their chicken soup. I just really like their flavorings. I think that they're the best so far. And I did try a little bit of Centrax, and I may be ordering 1 or 2 of those in the future if I get bored with the Undre. But right now I really like Undre, and I really like their chocolate, so we'll see if I still like it tomorrow. So I think that's it. Thanks. I see I got a few subscribers. I appreciate you guys subscribing to me. If you have any questions, feel free to ask. And no, you know, the day before I had surgery, I weighed 292. My follow-up appointment is going to be this coming Thursday, so maybe I'll make my next video after that. I'm not gonna be one to weigh a lot, so I'm sure they'll weigh me there, so I'll let you all know what I weigh. After that, they loaded me up with fluid, so I'm pretty sure that I'm higher now than I was before the surgery because I had a lot of fluids, a whole lot. So, okay, thanks guys. Take care. Bye-bye.